Hi, it's time for our coronavirus chats here at Wijnland Fertility again. At Wijnland, I would like you to introduce our last of our four embryologists, Birgit with you. As I said, with the Wijnland family, it's always nice to see how the family develop, and also you, over the past few weeks, we introduce our family who's going to treat you. Birgit is the oldest and longest embryologist at Wijnland, and it's so nice to introduce her and tell you a little bit more about the use of the embryoscope and why we at Wijnland is using the embryoscope and why we're doing single transfers at Wijnland Fertility. Thank you so much. I'm going to introduce Birgit.
Hi, my name is Birgit. I'm the senior embryologist at Wijnland Fertility Clinic. I've been here since 2016 and I started my career in 2005. Fertility is my absolute passion. I studied more in the animal field, always thinking I would work with endangered species, but ended up working in the human side and developed quite a passion for the field. Being a fertility patient myself, I realized what the patients go through and what their needs are. I'm half German, half Afrikaans. Grew up in Cape Town. And I'll just talk a little bit about fertility in general. I totally believe in patient-centered care and giving all the information to the patients and assisting them, but also to give them the right facts, good or bad, to make the whole process easier. And at Wijnland Fertility, we're definitely achieving that as well. So now if I go over to the embryoscope itself, when I started my career, I worked on conventional incubators, and we got beautiful embryos with the conventional incubators. But a lot of times when things don't go well, you don't always know what the reason for that is. It's quite frustrating because you'll have a couple sitting in front of you and you wouldn't be able to tell them why they're not falling pregnant. With the embryoscope, you don't always have all the answers, but it does help you get some answers along the way. So with a conventional incubator, you have to put the dish with the embryos in the incubator. And then if you want to see what the embryo is doing, you actually physically have to take the dish out and look under the microscope. But in doing that, you disturb the embryos and the whole culture system and environment, which is very important for good development. So lately, the trend would be for conventional incubators to leave rather embryos longer undisturbed, but your whole idea of what the embryos are doing aren't very clear, and you only look on day 5 and you see beautiful blastocysts, and it's not always easy choosing the right one. What is wonderful about the embryoscope is you can do your fertilization process and take your dish and put it in the embryoscope, and it's undisturbed for 5 days, and it's got a microscope and a camera built in. So the incubator takes a photo of the embryos every 15 minutes, which means we know exactly what those little embryos are doing. And embryos have got quite a strict division pattern that they need to follow. At certain times they need to do certain things. And we can get all these answers from the embryoscope itself. So from grading your egg, how the egg looks, is there anything abnormal that you can annotate? To division patterns, when it compacts, and what is the blastocyst quality in the end. So with the embryoscope, you can actually trace exactly how the little embryo is dividing, and then also use the quality of your blastocyst to decide on which embryo to transfer. So what does that mean? We can quite accurately say which embryos are the top ones. So you will unfortunately have to give your little embryos numbers 1, 2, 3, 4 in the order that you would transfer. And because you know exactly how that little embryo is dividing, it helps you to choose the right embryo. So that is why we do single embryo transfer, and we give each and every embryo its chance to cause a pregnancy. And most of the time, we actually do get it right. Sometimes there are embryos that surprise us, and it will be the second or the third embryo that would actually give you the pregnancy. The other answers that we can get from the embryoscope is, as you look at the development, if there are abnormal divisions on day 2 and 3, we know that we can account that more to the female side. And then from day 3 onwards, if the embryo has divided really nicely up until day 3 and then suddenly the quality deteriorates, you can count that more to a male factor, which gives you a bit more of an answer if you have to repeat a cycle, where to concentrate on. Is it more on the female side or is it more on the male side? What's wonderful about the Embryoscope, it fits in with the patient-centered care strategy, because we can always keep our patients updated as to what's happening with the little embryos, so that they also know what the expectations needs to be towards the end of the cycle. Is it good? Are there many embryos dividing nicely? Isn't it looking good? So at least on day 5, when you arrive for your transfer, you've got a very good indication as to what will happen. I can go into a lot more technical explanations about the Embryoscope. It's a wonderful, wonderful tool, and there's so much research still available and it needs to be done. And we see things that haven't been explained every day, which is makes our field so wonderful. But if you are looking for fertility treatment, the Embryoscope is definitely one of very good options that is available, because you actually can see what your little embryo is doing. It helps with your selection. You can put one embryo back at a time, freeze the rest of your embryos. And what we hope for all our patients is that we can do one cycle with beautiful embryos where a whole family can be completed from one cycle. And that's what we wish for all our patients. It doesn't always happen in all the cases, but we try and strive for that every day.